My name is Beth Johnston, and I'm from Shelton, Washington. I was working as the director of nursing at Furlane Terrace, and we were a member of the old United Nursing Homes. At that time, there were two associations. Those two associations joined, and Washington Healthcare Association was formed. My administrator and owner was a real believer in our being actively involved for all of the benefits, and so fortunately I was able to get actively involved right from the beginning. I have said to so many people through the years, join the association, join the association. Of course, as nurses, they don't have a lot of power. Try to talk your administrator into joining the association. Join the association. You need the support, you need the education, you need the help. It's interesting, I got to be involved in writing some legislation, and there are actually 5 words in a law that were Beth Johnston's words. I was so proud of that, and they are now so outdated. Those words were including the use of restraints. Oh my gosh, restraints are now a no-no, but at the time, so the field is always changing, always updating, and so the education's been important. And along with the education, the relationships. Groups of us getting together in regional meetings or meeting with people we'd met through those events. By bonding together, we had maybe a little power, but also people who were able to guide us through that process. My own mother is now a resident, 96 and a half years old, a veteran of World War II. She was in the 1st WAC Battalion, the 1st Women's Army Battalion that went overseas. She's very proud of that. She now has Alzheimer's, and that's one of the few things she remembers. But I'm able to be as good a daughter because of all the training and support and education that I got getting to this point. So a thank you to everybody who got me here. We had a state inspection. I had been director of nursing for a few years, and my owner administrator was gone out of the country. So I did the inspection, and when I got the results, I was floored. They were terrible. It was poorly written. Things like being cited for not doing shaves on men, but the patients they cited were women. There was this thing we had just learned about through Washington Healthcare called dispute resolution. The inspector, who thought that he was God, was furious with me, literally shook his finger in my face and said, "We gave you a very kind and gentle inspection. We will never do that again." I didn't know what to do. I called Washington Healthcare. Harry Riley was the executive director at the time. Fortunately, he was available. I don't know if he knew me from Adam, but he said, "Come on over." I told him what happened. I was going to have to get fired. He said, "I think what's going to happen. I think what's going to happen is that next year for your inspection, you're going to get a different surveyor. They're going to be very careful." And in fact, he was right. They ended up making a formal apology. We were assigned to a whole different zone. Now remember, we're the only nursing home in Mesa County, so switching our county was just paperwork. My fondest memory is getting that support when I knew I'd totally blown it. No, he was there for me. So that, to me, it's that mutual support from the staff of Washington Healthcare, from other members, that has just been invaluable. Thinking about the future, gosh, it can sound trite to say more of the same. That we have an active role for increasing quality, that we maintain a presence state and national, that we continue doing education. We keep getting new people into the field. Having that active voice and that mutual support that has done so well for us so far. I would always say to groups, at the break, it's your responsibility to get a cup of coffee and go to the bathroom, but also to meet one or two people and get their phone numbers that you don't know, so that when the chips are down, you've got somebody you can call and ask for help. So that's, to me, that's a wonderful thing.